So I like a little bit of steak. I like some food. And sometimes, I like to cheat, make it a little salty. I don't think I can give up all of that. Just like you, I know you have those same needs, but you cannot be in denial. If your blood pressure is more than 120/80, you gotta be on medications. It's better to be safe than sorry. What are the symptoms of high blood pressure? Okay. Unfortunately, this disease is called a silent killer because most people don't have any symptoms. Okay. Most people go years and damage is being done inside of them and no symptoms. Okay. That's why it is called often a silent killer. But what are the symptoms often people have with high blood pressure? Headache is a big one, especially headache in the back of your head, an early morning headache like that. Some people call it tension headaches, but those can be signs of uncontrolled blood pressure or blood pressure that's getting, higher. You can have nausea, you can have vomiting, especially when you have increase in your intracranial pressure because of blood pressure. You can also have dizziness, shortness of breath, chest pain, palpitations, feeling like your heart is pounding time to time, in your chest. So those also can be very, common symptoms of high blood pressure. When you have those symptoms, you have to seek care right away to prevent sudden death, heart attack, stroke, or any other damages to your health that can happen because of uncontrolled or elevated high blood pressure. So very important to remember. If you have to remember anything, often there are no symptoms. Your blood pressure is high, you're walking around, and you have no symptoms. But other times you can have those symptoms. One more symptom is really blurred vision. You can have blurred vision because of the pressure inside your eye caused by elevated blood pressure in your system. So all of that are very important to monitor. But the best thing to do after a certain age, especially if you have a family story, especially if you gain weight recently, especially if you've been living a sedentary lifestyle and you drink more than you should, smoke, you should have a blood pressure monitor and monitor your blood pressure because it's a silent killer. You may not have any symptoms at all and having big damages done in your body because of uncontrolled hypertension. Okay. Now, how do you diagnose hypertension? Okay. Usually you need 2 different measures or more, 2 or 3 or 4 or more, in 2 different settings. Okay. For example, at home, 2 different days, you measure blood pressure. Okay. You sit down, calm, not after exercise, not after you eat. Maybe do it in a time that you calm, early morning or late evening. You sit down, you put the cuff pressure at the level of your heart and you measure. Okay. Your hand has to be relaxed. Okay. You can use the one that goes on the wrist or the one that goes here. You got to make sure you have an appropriate size cuff. Okay. Medium size might work for many people, but people that are a little bit obese, overweight, you want a large cup, And kids, they have kid size cup. But again, an adult, I don't think you should ever be using a kid size, even though you feel like you are underweight. Maybe a small, a medium, or a large cup based on your size. Okay. Then you take 2 to 3 different measurements, 2 to 3 different days to see if you really have high blood pressure. And that means any number that is over 120/80, okay, that means you have high blood pressure. Whether you call it elevated high blood pressure, stage 1 or stage 2, depending on the number that you find. You can also detect that in the doctor office. When you go to a doctor visit, if you have 2 different doctor visits where the numbers are higher, you can also do a 24-hour blood pressure monitoring because some people, each time they come to the doctor, they say, oh, it's because of your white coat, even though, sometimes your doctor may look more like a banker, the way he's dressed. But your blood pressure is still high because you're in a stress environment. What I tell people usually, it happens also when you're in the street or when you're at home watching something you don't like on TV, when somebody cut you off in the street, or whenever you have a stressful moment, even momentarily, your blood pressure can go high and you can stay high for too long. So that has to be checked, and we have what we call 24-hour blood pressure monitoring. It's an easy to use equipment that you can go home with and measure blood pressure so you can see how it is at night, how it is daytime, and have a more understanding of what is your blood pressure. Those are the ways to diagnose your blood pressure. So you can do it at home by yourself. You can do it in the doctor's office. You can do a 24-hour blood pressure monitoring. All of those will help you diagnose blood pressure. Again, the number you're looking for, it has to be less than 120 over 80. Okay. Now, once you get a diagnosis of high blood pressure, your doctor is going to want some tests to see what's going on. He's going to check your blood tests, check your kidney to see if your kidney function is normal, do an electrocardiogram, do an echocardiogram. The electrocardiogram look at electricity in your heart. You already have hypertrophy, which means, enlargement of the muscle of the heart because you've been pumping against a high pressure. Echocardiogram that can prove valve function, the thickness of the muscle of your heart, and can give you the signs of high pressure in your body. In the blood test, they can also find glucose. Are you diabetic now? Do you have thyroid problems? All of those can give high blood pressure. There are more tests that they can do specifically if you're young to look at why you have hypertension. Is there a secondary cause or not? Often, all those tests come back normal and you truly have essential hypertension. Now that we talk about that, what are the treatment available for high blood pressure? Number one is lifestyle changes. Okay. Whether you have what we call elevated blood pressure, stage 1 or stage 2, you got to do lifestyle changes, which means take more exercise, more potassium in your food, more fruits, more vegetable, try to lose weight, or try not to use any drugs, decrease your caffeine intake, stop drinking, stop smoking. Those you have to do no matter what the treatment. Now, if your blood pressure is more or even equal to 140 over 90, and you already have other disease like diabetes, like high cholesterol, or a strong family of heart disease, you need to be on medication. You need to be on medications, okay? Of course, you're going to tell me, well, let's do diet and exercise first. My answer is always yes, you can do that and exercise, and you should always do that, but while you're on medication. Of course, if your blood pressure becomes so good, you lose weight, you decrease your salt intake so much, then we back up on medication. We back up off medication. And if we have to stop them, we even stop them. But we don't want to wait 6 months to a year. You're doing organ damages and you know you're not getting there, but you're still in denial. I call that in denial, without treating your blood pressure. So you gotta be on treatment. And the treatment are medications. Okay. First line, most likely, and many young people would know the risk factors, thiazide diuretics. Very good medication. Hydrochlorothiazide, chlorothalidone. Okay, you can, depend on the number, you can start with a small dose and increase it as needed while you watch your number, while you're doing lifestyle change and everything. You also have ACE inhibitors. Those are first line for diabetic patients because they also protect your kidney. And those, like Sanopril, Enalapril, Captopril, those type of medication, they should not be taken by pregnant female because they can give pollen to the fetus. But otherwise, they are really well-tolerated medication that also protect your kidney if you're diabetic. Also, the same thing for angiotensin receptor blocker. Those are the losartan. Those type of medication will also protect your kidney. Very good medication for diabetics, first line for diabetic. You also have the calcium channel blocker, such as amlodipine, nifedipine. You also have diltiazem. Those type of medication, there are also others that are less common that also help. And often you have to use two. You have to use a combination. So you can use a combination of the diuretics with the calcium channel blocker. You can use a combination of the diuretics with the ACE inhibitors or the other medications that I mentioned to get you result. We also have other form of diuretics such as potassium sparing diuretics. You have aldactone, eplerenone, those type of medication. Whenever you start those medication, you got to check your kidney, your potassium level. Usually within a month or so, the doctor may ask you to have those tests done to make sure you don't have any side effects of those medication. And if you have a side effect for one of those medications, call your physician and tell him. There are other medications that can be used. So you don't have to completely stop the medication because other medication you might tolerate them very, very well. We also have the beta blocker, which is a very common medication used, especially for people who have heart disease. They are not first line because there can be some side effects with those. But if you have heart disease, if you have heart attack, if you have, they can be very beneficial. So those are the medications for treatment of blood pressure. There are also natural remedies. Some of them works. On average, they give you anything between 5 to 10 millimeter mercury of decrease in your blood pressure. For example, garlic. Having tea with garlic, you probably have to do that 2 to 3 times a day. That will help. I don't think those herbal medicine can replace medication. But no matter what you do, your number has to come down to less than 120 over 80. And most of the time you find success if you use a combination of these things. Okay. Also, you have hibiscus tea that also help a lot of people. You probably have to do 3 times a day again, getting tea often to get a quantity that can really help blood pressure. There are also beetroots and the red, beetroots. If you that juice also help with blood pressure. Those are just some of the natural medicine that people use for blood pressure. I would say use those in combination with your medication for blood pressure, okay, in your lifestyle changes, okay. And then if you can do a very good job with lifestyle changes, natural medicine in your medication provided by your physician, as long as there's no side effect into those medications, just like those I just told you, you can use them. Then you start by cutting up your medication when your blood pressure becomes normal and you do such a good job, you lose weight, you less salt, you change your lifestyle, blood pressure start to be even lower than needed. Then you start by cutting your medication, cut the dose in half, talk to your physician, reduce the dose, and eventually some people get off medication, okay? But it's rare because most of the time you need medication to maintain a healthy blood pressure, which is the case for me. I also enjoy good food. On rare occasion, I drink, maybe once or twice a month with friends. I get a drink, not more than that. I like coffee in the morning, sometimes 2 cups. So I don't think I can give up all of that, So I like a little bit of steak. I like some food. And sometimes, I like to cheat, make it a little salty. I'm human. So just like you, I know you have those same needs. So, but you cannot be in denial. So if you have good blood pressure and you get away with those things, that's fine. But if your blood pressure is more than 120 over 80, you gotta be on medications. And I am on medication for blood pressure. I can use my own story to tell you. So it's very important because it's better to be safe than sorry.